All right, let's take a look at cervical rotation, which is going to be slightly different from the other manual muscle tests that we have completed. So the position of the patient is going to be supine with the cervical spine in neutral, which is how we're at right now. The head's going to be supported by the table. The face is going to be turned to one side as far as possible. So go ahead and turn that all the way to the right. As we mentioned before, when you're looking to the right, that left side is doing the work. Okay, we are going to be standing or seated at the edge of the table, facing the patient, of course, and the hand is going to be placed over the side of the head above the ear, okay, for grade 5 and 4 only. So go ahead and look to the right and now the left, all the way to the left. So now, keeping the head in neutral position, look all the way to the left. There we go. So now I know, and the patient knows, go ahead and do that for me now. Okay, that's full range of motion and full range of motion. So now I know that's how much range she has, so I automatically can give that a grade 3 because the patient is able to rotate through available range of both right and left without any resistance, except for gravity. Okay, so now a grade 5 is going to be a patient's going to rotate the head through that full available range to both right and left against max resistance. So go ahead and start with your head all the way to the right. Yep, and I want you to turn your head all the way through the full range. So go ahead and turn, 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 turn. Keep going, keep going, keep going. All right, so I was unable to break her, and she was able to hold that range through the maximum resistance. And a grade 4 is going to be, I would of course do the same thing here. Go ahead and again push against my hand, push, 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 push. My hand's above the ear, all the way through, maximum resistance. So I am unable to break her here, so that's going to be a grade 5 as she completes that full range. A grade 4 is the patient is going to rotate the head through that full range of motion again to both right and left against moderate resistance. So again, the hand is going to be placed here above the ear, so go ahead and complete that range of motion. And she's having a harder time completing that range, so I may assign that a grade of 4. Again, or the alternative way is that moderate resistance is you're going to be applying. So do they break or unable to hold that contraction throughout that full range? I would consider that a 4. Okay. A grade 3 we already witnessed, going all the way full range of motion to the right and to the left. Grade 2 is the patient is going to be sitting. Okay, so go ahead and sit up for me. Okay, right there is fine. Now the patient is sitting, the trunk and the head may be supported against the high back chair if needed. I'm just going to put my hand here for now. The head posture should be in neutral. We are going to be standing directly in front of the patient, and you're going to want to have the patient try to rotate their head from side to side, keeping their neck in neutral. And you want them to turn as far to the right and to the left as you can. And then grade 2 is going to be partial range of motion. So go ahead and let's put you with your back up against the wall here. So what I want you to do, now they're supported, I want you to try to look to the right and look to the left. And a patient will only have partial range of motion if it is a true grade 2. A grade 1 is going to be contractile activity in the SCM, as we mentioned before, with no movement. So I have them lie back down here on your back. Okay. You're going to ask them again, try it and have your shoulders down. If she's looking to the left, it's going to be that right SCM, and looking to the right, it's going to be that left SCM. So go ahead and try to turn your head to the right or the left. Okay. So as she turns, you're going to be feeling for that contractile activity at that SCM. And again, a grade 0 is going to be no palpable contractile activity, in either palpable or visual. Sometimes with the SCM, you definitely can see it happen. So go ahead and turn to the right there. And you can automatically see the SCM pop up right there. So go ahead and show that one more time. Yeah, good. All right, thank you.